Welcome back, everybody. Recently, there's been a lot of talk about Gardasil, the vaccine given to young girls to prevent cervical cancer. 6 is on call on a Wednesday afternoon. The question is Gardasil effective for older women, too? We're joined now live by Ochsner Gynecologic Oncologist Dr. Bazzett, and it's good to talk to you again. First of all, tell us exactly, for those who don't know, what is Gardasil?
Gardasil is a vaccine, and it's a non-live virus vaccine that protects against the 4 most common types of human papillomavirus.
All right, so we know what it is, and we kind of reference the fact that maybe some younger women take it. Is Gardasil effective for all women, older women too, or must it be given only to younger girls?
Well, it depends on what you consider older women. Right now, Gardasil is approved in girls and young women aged 9 to 26. And it's only limited to those age ranges because those are the age ranges that the initial studies were performed in. And so that's where insurances are paying for the vaccine right now. However, there are more recent studies that show that Gardasil is also effective over 90% in women up to age 45. But that information has been presented to the FDA, and we're still waiting on approval for the vaccine in women up to that age range.
How long does that type of approval usually take, have you found?
Well, this was actually presented to the FDA and is on an expedited track, and typically in an expedited track that information will come back within about 3 months, and it was about 6 weeks ago that was presented, so we're hoping any time now we'll get that information.
Let's talk, if you will, just for a moment, Dr. Bazzett, about the risks that may be involved with this vaccine. Are there any?
This vaccine is actually very safe. There have been no major side effects associated with the vaccine. You will get a little bit of itching and burning at the injection site. You can have some low-grade fevers, and these are all really side effects of any vaccine.
What would you say is the most important thing, Dr. Bazzett, for women to know if they are interested in maybe getting this?
The most important thing to understand is that really all women are at risk for HPV. This is not a virus that affects certain women over others. There are certainly things that put you at higher risk, but all women are at risk because this is a virus that 80% of men and women in their lifetime will be exposed to at some point. And I really think it's important that women, if they are especially in the recommended age range right now, 9 to 26, and they ask their physician for the vaccine, if they're told that they're not a candidate or they really don't need it, I would really suggest that they seek out another physician to talk about it a little bit further, maybe speak to a specialist, a gynecologist, so that they can be counseled a little bit more specifically.
Sure. All right, Ochsner Gynecologic Oncologist Dr. Bazzett, good to talk to you today. Thanks for joining us.
Thank you, you too.